To mark World Hypertension Day on May 22, 2026, the federal government of Nigeria, through the Federal Ministry of Health and Social Welfare, organized a public road walk in Abuja to tackle rising cases of hypertension, high blood pressure, and diabetes. Led by the Office of the Coordinating Minister for Health and Social Welfare, Professor Muhammad Ali Pate, the 2-kilometer walk started at the Federal Secretariat Complex and was implemented by the Non-Communicable Diseases Control Division and National Primary Healthcare Development Agency with support from non-government organizations and international partners. Ministry staff distributed informational flyers to pedestrians and motorists along the route to NPHCDA's office, ending with public awareness sections in English and local languages at Garki Ultra-Modern Market. Heads of departments including Dr. Malau M. Toma, Dr. Suleiman A. Lamorde, and Bunmi Oshundele shared statistics on hypertension and diabetes as leading preventable causes of death while stressing lifestyle changes to reduce risk.
For you to ensure that the blood pressure is controlled through screening, for those that have the condition, they are placed on medication prescribed by healthcare workers. And as soon as you are placed on medication, the person is required to take his medication consistently, adherently, without break in taking of the medication. Otherwise, the blood pressure will not be controlled.
So our own call to general public is to patronize these facilities. We should not sit at home and do traditional medicine, to do babalao, to go to prayer warriors and so on. These are some of the things that we have seen in the past, and it's complicated. Because if you go to all these prayer houses, babalao, imam, whatever you want to call them, and then you tend to develop serious complications. If you come to the best of centers, there's little or nothing they can do.
We have a coordination mechanism for the 36 states, ministry and agency. We have focal persons where we are trying to encourage the states to also imbibe what we have at the national to ensure that they have state level NCD a multi-sectoral approach to control NCDs in the country.
Partners like Ademuyiwa Damilola of Legislative Initiative for Sustainable Development LISDEL and Dr. Onyekachi Osabiku of Resolve to Save Lives called for government funding for NCDs and non-communicable diseases similar to infectious diseases and urged adults 18 years and above to adopt preventive habits and make regular blood pressure checks routine.
We want to see a situation where we have programs that were created for HIV/AIDS, for malaria, also created for hypertension and other non-communicable diseases. This will ensure that all the MDs, especially Ministry of Health, that are implementing programs and activities around hypertension have access to the resources they need to do their work in terms of making available materials and services for screening, for diagnosis, for treatment and long-term care for hypertension patients.
Every person above 18 should ensure that they get their blood pressure checked, and it's something that is a vital sign that prior to seeing any health worker is checked.
The 2026 campaign theme was Controlling Hypertension Together, Check Your Blood Pressure Regularly, Defeats the Silent Killer. Officials highlighted that 1 in 3 people globally have high blood pressure, but only 1 in 2 are aware, since it often shows no symptoms. With hypertension complications claiming about 10 million lives yearly worldwide, the federal government's road walk aimed to boost public awareness and early detection. Raymond Ken-Mbata reporting for Health Farm Media.